Yeast infection, also known as vaginal candidiasis, are common occurrence in pregnancy due to hormonal fluctuations and can affect the vaginal environment. It is caused by an overgrowth of Candida albicans in your vagina. So, what are the causes? Hormonal fluctuation, that is, elevated level of estrogen during pregnancy can cause the vaginal environment to become more favorable to yeast infection. Estrogen increases your sugar level in vaginal cell, providing food for the yeast. The next one is weakened immune system. Pregnancy naturally suppresses the immune system to protect the fetus, but this is also making it more susceptible for infection. That is, the body to be more prone to infections. The next one is increased vaginal discharge. The high production of vaginal secretions can make it easier for yeast to thrive in the vagina, making you to have more discharge during pregnancy. The next one is antibiotics. Pregnant women who are sometimes prescribed antibiotics, which can disrupt the balance of the good and bad bacteria in the vagina, promoting yeast overgrowth. So, once a woman is pregnant, her immune system becomes low. Symptoms: when you have itching and irritation, persistent itching in the vaginal area can be a symptom, and burning sensation during urination and the intercourse can be a sign of this yeast infection in pregnancy. The next one is you are having white thick discharge resembling a cottage cheese. This discharge typically lacks a strong odor. So it has odor and is thick like a yogurt. Also, you have redness and swelling in the genitalia can be a sign. Soreness, a general sense of discomfort or soreness around the vaginal area, that is the vulva, maybe a boil, can signify this infection in pregnancy and it needs to be treated. So the next one is a yeast infection is usually diagnosed through a pelvic exam, during which a healthcare provider examines the vaginal discharge, or a sample may be taken to confirm the presence of this Candida albicans under microscope. Treatment: antifungal medications are used in form of creams and suppository containing cotrimazole and miconazole are commonly prescribed. So these drugs are considered safe during pregnancy and used under medical supervision. Avoid oral antifungal medication because it's not safe during pregnancy, especially in the first trimester, due to potential risk of birth defects. Maintaining hygiene, keeping the area clean and dry is essential. Prevention: wear a loose and breathable clothing. Tight clothing and non-breathable fabrics can trap moisture and heat, promoting the yeast growth. So choose a cotton underwear and avoid wearing tight-fitting pants for a long period. The next one is maintain proper hygiene. Gently wash the genital area with mild soap and water. Avoid using scented products like sprays, douches, or harsh soap, which can irritate the vaginal tissue and disrupt its normal balance. The next one is keep the area dry. After bathing or swimming, thoroughly dry the genital to prevent moisture buildup that will encourage yeast growth. Eat balanced diet that contains probiotics, which can help to balance the natural bacteria in the vagina. Limit sugar intake. Yeast thrives on sugar, so reducing your sugar intake can prevent the infection. Use of antibiotics wisely, only when your doctor prescribes it for you and it's necessary, because consistently taking it can disrupt the vagina. Then complication: if you do not treat your yeast infection, it can result to chronic vaginal infections that can cause chronic irritation, leading to more severe symptoms. Then the next thing is, if you didn't treat a yeast infection, your newborn can have this yeast infection. That is, a baby can contract this yeast infection, which is usually manifested in form of oral thrush and also nappy rash. Why it is treatable? So avoid it to your younger infants. If this video has added value to you, don't forget to subscribe to this channel, like this video, and share to your family and friends. See you in my next video. Bye.